So what is strep throat? It's not a viral infection. It's actually a bacterial infection that's caused by this pathogen called Streptococcus pyogenes. And it is more common in children. Adults can also get it and sometimes get tested for it as well if we're concerned, but it's especially most common in kids. And it spreads very easily in schools because they're in close contact with a lot of other kids. It can spread pretty quickly in schools and buses, trains, workplaces, and households. The signs and symptoms of it are like sore throat, especially the pain when swallowing. With strep throat, you also get a fever with it. So it's always like 101 degrees or higher for kids. And sometimes it could start as kind of like a lower grade fever for people. And then you will sometimes see swollen tonsils, not always, but you can often see swollen tonsils, and can also kind of with kids like in lymph nodes in the neck, and oftentimes like underneath the ear and kind of behind the mandible area. You can kind of feel for lymph nodes that may be swollen and sometimes tender. And that kind of shows us that there's some sort of infection going on. You could get swollen lymph nodes with strep throat and then also with other like viral or bacteria infections. But that's something that also with kind of like a sore throat type picture makes us suspicious for strep throat for kids. And then often people will complain also of like the sore throat and then also like headache. And then sometimes kids will also get rashes as well. And that's not always consistent, but it sometimes happens. In terms of what it looks like, when you go to the doctor, they'll often look in the throat and see these white spots are usually in the back of the throat by the tonsil area and by the roof of the mouth, but like farther back. You could sometimes see like even red spots and then like a swollen uvula that's in the middle of the tonsils. Even if there's just white spots or just some red spots in the back of the throat, that makes us pretty suspicious for strep throat. Having some gray spots on the tongue is not as consistent or like not quite as common as the white spots in the back of the throat, but that can also happen. If you're suspicious that your kid has strep throat, you could also look inside their mouth with like a flashlight and see a throat that looks inflamed. Prior to the white spots even developing, you can see a lot of redness and inflammation, and then some of those like petechiae, which look like blood spots. All of those symptoms resolve as strep throat gets resolved and treated. So it's not something to be concerned about that their throat or your throat is going to be affected by it. That's also why some of the treatment and prevention is important. Strep throat, it spreads through respiratory droplets. Those droplets are from sneezing, coughing. A lot of bacterial and viral infections transmit through respiratory droplets. And this is also why for like most illnesses or most respiratory diseases, just a normal mask can be enough because their microscopic bacteria are in these microscopic droplets, but they're not small enough droplets that they transmit through N95 masks or transmits through regular masks. So that's the difference between COVID. We wear the N95. Those viruses transmit just through the air on its own. It doesn't need tiny water droplets to transmit. So that's still why the normal masks can still be preventive for COVID, but N95 is like the ultimate one, especially for the COVID ones that are like really virulent or really transmissible. So this usually transmits through sneezing, coughing, touching contaminated surfaces, sharing utensils or cups, and just being in close contact with someone who is sick. Things that we want to teach our kids of really trying to sneeze like covered, because that will also prevent the spread of strep throat. So prevention for it, washing your hands is the most important, and especially encouraging kids to wash their hands and wash their hands well. I think through all of the stuff with COVID, we've learned that it's really important that you're washing your hands for 20 seconds, and really teaching kids that like the technique of washing your hands is actually very important, because just kind of like having a soap like over your hands doesn't necessarily get rid of all of the bacteria on your hands. So really making sure you are rubbing your palms together, putting your fingers through your fingers. I feel like with kids, I'll be like trying to make an octopus and encouraging them to do that in that way of really getting in between the fingers and rubbing knuckles together and cleaning thumbs, and then rinsing your hands and drying them in a clean way. So a towel, and making sure if you are using hand towels to exchange those hand towels like every few days at least, if not every day. And then also keeping like sanitizer as well, and encouraging kids to use sanitizer. In terms of sanitizer, I think that especially in the wintertime, and now we're getting a little warmer, but just making sure you have sanitizer and then also lotion, especially for kids. Hands could get dry really quickly. And then wearing a mask like we've talked about before. So really encouraging that, especially in New York and on the subway. We reiterate this constantly, but it's very important that we're wearing masks because things are spreading more. And especially because the vaccine's becoming not as common, the herd immunity is going to be helping us a little less, unfortunately. And those of us that know that this is important and value it, we want to be precautious conscious and be part of helping mitigate that spread and helping yourself and your family stay safe against a lot of these illnesses. And this can help with the strep throat as well. It's hard to keep kids in a mask throughout the day at school and all of that. It's a little challenging, but I think doing a mask, like at least on the train, or like if you notice even someone sitting near you, I sometimes feel weird about that on the train. If someone's like sneezing a lot and putting on a mask, like I don't want them to feel bad, but then also at the same time, it's like they should be wearing a mask. It's important that we are protecting ourselves. It's good to always stay masked and don't feel bad about making other people feel uncomfortable, or other people feeling uncomfortable now that people are like, we shouldn't be wearing masks at all. It's a very important thing to be doing. Just covering your coughs and sneezes, like especially sneezes and coughs too, they project so much and go so far. Making sure you're covering really well and really teaching kids that it's not the hand. And if they do sneeze in the hand, making sure they have sanitizer. We sanitize right away after that, but the hand will spread everywhere else, and really doing it within the elbow and really covering it up. And if they're able to sneeze within a mask, that's even better. But sometimes I know sneezing within a mask is comfortable, especially for kids. But as adults, I think we have the capacity. When you sneeze, you still need to cover within that mask because it can project through the mask if you don't cover. And then avoiding sharing cups and eating utensils, and encouraging kids to avoid that as well. Make sure they have clean utensils themselves and not sharing as much with other people around them, especially anyone that's looking sick. And then a huge thing, disinfecting surfaces, because kids are bringing home a lot of things. I think disinfecting surfaces is a huge thing because most of our transmission of things is through hands and through touching. Just making sure that we're careful about that and really trying to keep our area clean at home. When to see the doctor, having fevers over 101. Kids, you can give Tylenol when they're having fever, but if you're having to give Tylenol like for a full day or 2 days, they should be seen by a doctor. Any difficulty swallowing or breathing, and seeing those white patches or pus on the tonsils, especially if there's pus on the tonsils, that's immediate. You should go see the doctor or go to the emergency room, because that means they need antibiotics right away if they're not already taking the antibiotics. The white patches, the fever, those are alarming signs for strep throat. There's no improvement after like 3 to 4 days of just having a sore throat, then that's a time to see the doctor. When you go to the doctor, they'll first examine you and see how your breathing is, assess all the symptoms that you or your kid is experiencing. The big test for strep throat is a swab test. It's a swab in the throat. They may also test for COVID and flu as well. If it comes back positive, or even if when there's a high suspicion for strep throat, before we even get the positive result, we may start antibiotics right away, especially if there's pus on the tonsils or other concerning things. But especially if there's been 3 days of it's not resolving and there's white spots, that gives us enough suspicion to start antibiotics even without necessarily getting the test. But they'll still do the test just to confirm. And sometimes that throat swab test has some other things they test for, like COVID, flu, RSV, and all of that. Only 10 to 15% of actual sore throats are strep throat. It's from a viral infection usually, rather than from strep throat that's caused by a bacteria. And we want to avoid like antibiotic resistance. We don't want to be just giving antibiotics anytime there's a sore throat, because there's other things that help. And that's also why doing soothing things for the throat in general can be helpful while you're waiting for like 3 days of seeing, like, I've had a sore throat for a bit, I don't notice white spots, and I don't have pus on my tonsils, I don't have fevers. It's probably not strep throat. It'll probably resolve after 3-4 days, or at least start getting better. But if it's getting worse, or the fever is really consistent, then that's when you see the doctor and you probably need antibiotics. Most sore throats are from viruses, and viruses are not treated by antibiotics. People sometimes have this placebo effect with the antibiotics, even when it's a viral infection, where they're like, I took it and then I'm better after 3 days. That was just the virus getting out of your system on its own anyways. It was starting to get better after 3 days, and less so because of the antibiotics. The majority of sore throats are not from this bacterial infection. You'll just need to wait it out and do some soothing things, because unfortunately, like we know for viral infections, there's not always a lot of treatments for it, especially for kids. It's waiting it out. So symptoms that are more common in strep throat is it comes on very suddenly, and it's a very severe sore throat, very uncomfortable, and a lot of discomfort swallowing. For a lot of kids, it can affect them feeling like they want to eat or can eat because it really hurts to swallow. And then fevers without the cough and congestion. So if there is that piece of feeling that there's cough and congestion, that makes us more suspicious for a viral infection that's causing the sore throat, or maybe COVID or RSV that may be causing some of the sore throat. But the fevers, the very severe sore throat, it's starting really quickly. You don't have to wait 3 days if you're having fevers and it's really painful. You can see the doctor immediately and get tested. Home care ideas, and this is the same thing for if it's not strep throat, but just like a sore throat, and can also help with a lot of the congestion and common cold symptoms. symptoms. Hydrating is so important. A lot of our appetite and thirst levels go down when you have a cold. So it's a thing you have to remember to do is hydration. Often doing like supplements or vitamin C, like the fizzy things you add in water, is also helpful. Doing warm tea and warm liquids in general if you don't like tea. Coffee, not so much because that has like a lot of caffeine. Gargling salt water is actually really huge at soothing your throat. It is an arbitrary amount of salt water. Just putting like a half a teaspoon of salt or a teaspoon of salt in half a cup of water and just gargling it a little bit and then spitting it out can really help soothe the back of your throat. And humidifier. Throat lozenges, cough drops, those can be really helpful. Even though cough drops are for cough, they can often be soothing for the throat itself too. Pain medicine is Tylenol mostly. And Advil for kids, we don't do as much, but as an adult, you can do a little bit of Advil. As a reminder, the symptoms of long COVID, people being most at risk if you don't have the COVID vaccine, and remembering that we have the updated COVID vaccine, making sure you're up to date on that because that also increases risk of those symptoms staying around. Long COVID covers a lot of symptoms, and staying up to date on all of our vaccines, getting the flu shot. Flu season's kind of ending now, but if you haven't gotten it, it's still a good idea that can protect you and your family from the flu. And then RSV if you're over 6 years old, to make sure you get that one shot that you need. And then a pneumonia vaccine too, especially if you're high risk, doing it before you're 65, but you need one dose when you're over 65. Pneumonia is a thing, especially for older people, that can really put you in the hospital. So making sure we get that pneumonia vaccine too, along with our COVID, flu, and RSV shots.